Hi, I'm Marnie, and today we will be talking about the pathophysiology and pharmacology of cystic fibrosis. In this video, we'll be talking in relation to Jacob, who you've been introduced to on the SWAY website. Cystic fibrosis is an inherited disorder that affects the endocrine glands of the respiratory and digestive system. Cystic fibrosis is caused by a mutation in the CF transmembrane conductance regulator, also known as CFTR. And throughout this slide and the rest of the presentation, it'll be known as CFTR. This CFTR protein is produced by the gene and regulates the movement of chloride and sodium ions across the epithelial cell membranes. Normally, cells of the endocrine glands produce mucus, sweat, digestive enzyme, and these secretions are typically thin, watery, and slippery. This is good as they are thin enough to pass through the airways without causing any blockages. They act as a lubricant. Now, in cystic fibrosis, this defective protein causes those secretions to become sticky and thick, which builds up in the lungs and digestive system and blocks the major passageways. This causes issues for Jacob, like being unable to breathe, having mucus on his chest that needs to be coughed up, and becoming prone to upper respiratory infections due to the thick mucus sitting in these spaces. A mutated CF transmembrane conductance regulator, or CFTR, protein disrupts the movement of chloride ions across the cell membrane, as shown in the image drawn below. As well as disrupting the normal chloride ions, this defective protein disrupts the normal movement of sodium across the cell membrane, as seen in the image below in pink. And remember, where water flows, sodium goes. So now that we're disrupting water from reaching the cell surface to make it nice and slippery, and this is when thick mucus forms. Because cystic fibrosis affects our lungs and digestive system, all of our other symptoms will revolve around that. Some of these symptoms are earlier signs, respiratory, gastrointestinal, and skin. First, we look at the earliest sign. These symptoms include failure to pass stool, abdominal distension, vomiting, and rapid dehydration. Next, we look at how the respiratory system is affected. There is thick, sticky mucus that's built up and causes airway obstructions. There's wheezing and air trapping. Reoccurring lung infections and upper sinus issues will be happening. You also have a stuffy nose and a blocked throat, and a high risk of infection due to mucus being stuck. Next, we're moving on to the gastrointestinal section. Thick mucus will plug the channels that carry enzymes from the pancreas to the small intestines, this decreasing digestion and absorption. Some other symptoms are greasy, foul-smelling stool, constipation and pain while passing stool, malabsorption of vitamins A, D, E, K, and proteins, poor weight gain in children due to not being able to digest fats, and this can also lead to diabetes, which is pancreas fibrosis. Next, we move on to the skin. So the sweat glands increase the sodium in sweat and saliva, the risk of electrolyte imbalances, and also a weird one, but baby's skin may taste a little bit salty. Now we're moving right on to the medications. Medicine to treat cystic fibrosis try to maintain and improve lung function, fight infections, clear mucus, and help breathing. Or they try to improve how somebody's CFTR protein works. The two medications that I'm going to be talking about are bronchodilators, which open the airways, and mucolytics, which reduce the thickness of the mucus so that it can be easily removed. Bronchodilators are medications that work to open up the airway by relaxing. In cystic fibrosis, short-acting beta antagonists are used. These are inhaled orally through a mediated dose inhaler. Less common, but they can also be taken through powder inhalators or nebulizer. This drug is used because the patient's airway is reduced due to inflammation and contraction of the muscle. Before commencing this medication, Jacob's allergies and other medication contraindications need to be assessed, as well as respiratory monitoring and regular observations to ensure medication is working the way that it should be. The dosage should also be updated depending on Jacob's needs and changes to his cystic fibrosis. The mechanism of action. So this drug acts on the B2 receptors, including this bronchial smooth muscle relaxation and inhibiting immediate hypersensitivity mediated release. This has little effect on the heart rate. The image on the right shows how the medication acts on the B2 receptor on a cellular level and shows the intended outcome of this process by showing a cystic fibrosis affected airway above and an unaffected airway below. Now we'll be looking at mucolytics. The job of these drugs is to reduce the thickness and volume of mucus buildups in the airway passages. They work by breaking down the mucus into smaller amounts so that it is able to be removed easily with other therapies. In the image shown to the left, the healthy lungs with clear airways, and on the right shows lungs that are affected by cystic fibrosis. These lungs have mucus buildups. This is why people living with cystic fibrosis depend on a medication regime that is made to reduce and remove mucus buildups in the airways so that they're able to breathe again. Well, this brings this presentation on the pharmacology and pathophysiology of cystic fibrosis to an end. My references for this video will be displayed in my SWAY website at the very end so that they are able to be accessed. Thank you for watching.